Hello, my name is Morgan Knuckles. I was born July 26, 1993, Torrance, California, with severe left CDH. It was not found before I was born. Once it was found, I had a helicopter ride to another hospital, Huntington, to a surgeon that knew about CDH, was on ECMO for 7 days, taken off of it before the first diaphragm repair. About a week after the first repair, pH was found, pulmonary hypertension. It did go away, and then at 6 months old, after being home for about 6 months, had pneumonia for the first time, and then the finding of the patch not holding, so a second patch was placed. After the second patch was placed, I contracted RSV. Medication I was put on didn't help heal the RSV for my little lungs. So from lungs not being healed enough to grow as normal as possible, I have chronic bronchitis that connects to my pulmonary hypertension. 7 months old, I had my first and only stroke. So I still see a neurologist yearly. I have had off and on seizures as I grew up. My pulmonary hypertension was found again at age 8, March 2002. Saw each doctor. Cardiologist was the final doctor I saw. Echo showed my pH. So I was back on oxygen full time. I was just using it for bedtime. I gained water weight and had a few too many seizures when my pH was found in 2002. By 2005, after off and on pulmonary function tests, I was sent to UCLA. I still go to UCLA in the more adult care with now pulmonary doctors, not just cardiologists, and now a GI doctor. My first pH medication was Triclear in 2005. In March 2006, had St. Patrick's Day, had my scoliosis repaired. 2 rods and a certain amount of screws just around my rib cage. About a year later, February 2007 until July 2008, had my 4th diaphragm hole, smaller hole, just big enough for small intestine to go inside of it and die off. So some small intestine and then some large intestine were taken out. I had a central line with TPN, nitric oxide, iron, water diuretic, sildenafil, Triclear still. All of that from February 2007 until July 2008. July 2008, before I turned 15, the central line was taken off and the ostomy bag was taken off. Since I found both communities, I've been helping both sides with my pieces of my long story. If it's similar to their own or their little ones, then I help them out if they have pH. Met with the pulmonary doctor in 2001. He did a chest CT and pulmonary function test. Chest CT showed 1.5 lungs and damaged air sacs, which leads to chronic bronchitis connection to my pH. Then June 2022, I met with lung transplant doctor until into my 50s. This year I'll be 30. October 2022, saw a GI doctor, he did a few tests for him, GI imaging. They found my 5th hernia, a hiatal hernia above my stomach, gastroparesis, and spontaneous GERD. 3 of these are common CDH issues. Earlier this month, in March 2023, I went to see my new primary pulmonary doctor. He saw a few older tests back in 2006 of how much blood flow goes to each lung. Right lung, that's 100%. It handles 73% of blood getting oxygen. It does the most work. Little left CDH lung, 50%. It handles 32% blood getting oxygen from the damaged air sacs. I'm back on iron since March 8th and on 3 pH medications and an inhaler for my bronchitis and anti-seizure medication, plus a GI med to help my GERD and gastroparesis. This is my CDH story, severe left CDH. My name's Morgan Knuckles. April is CDH Awareness Month. Shared my story.